The nurse is caring for a young adult patient on the medical surgical unit. When doing midnight checks, the nurse observes the patient awake, putting a puzzle together. Which information will the nurse consider to best explain this finding? A. The patient misses family and is lonely. B. The patient was waiting to talk with the nurse. C. The patient has been kept up with a noise on the unit. D. The patient's sleep-wake cycle preference is late evening. Answer: D. The patient's sleep-wake cycle preference is late evening. Rationale: this patient is awake and alert enough to do a puzzle. The individual's sleep-wake preference is probably late evening. All persons have biological clocks that synchronize their sleep-wake cycle. This explains why some individuals fall asleep in the early evening, whereas others go to bed at midnight or early morning. Waiting to talk with the nurse, being lonely, and noise on the unit may contribute to lack of sleep, but the best explanation for the patient being awake is the biological clock. The nurse is providing an educational session on sleep regulation for new nurses in the Sleep Disorder Treatment Center. Which statement by the nurses will best indicate that the teaching is effective? A. If the patient has a disease process in the central nervous system, it can influence the functions of sleep. B. If the patient has a disease process in the cranial nerves, it can influence the functions of sleep. C. If the patient has an interruption in the urinary pathways, it can influence the functions of sleep. D. If the patient has an interruption in the spinal reflexes, it can influence the functions of sleep. Answer: A. If the patient has a disease process in the central nervous system, it can influence the functions of sleep. Rationale: sleep involves a sequence of physiological states maintained by the central nervous system. It is associated with changes in the peripheral nervous, endocrine, cardiovascular, respiratory, and muscular systems. A disease process associated with the cranial nerves, urinary pathway, or spinal reflexes may influence a person's ability to sleep. But the best answer is the central nervous system. The nurse is completing an assessment on an older adult patient who is having difficulty falling asleep. Which condition will the nurse further assess for in this patient? A. Depression. B. Mild fatigue. C. Hypertension. D. Hypothyroidism. Answer: A. Depression. Rationale: older adults and other individuals who experience depressive mood problems experience delays in falling asleep, earlier appearance of REM sleep, frequent awakening, feelings of sleeping poorly, and daytime sleepiness. A person who is moderately fatigued usually achieves restful sleep, especially if the fatigue is the result of enjoyable work or exercise. Hypertension often causes early morning awakening and fatigue. Alcohol speeds the onset of sleep. Hypothyroidism decreases stage 4 sleep. The nurse is caring for an adolescent with an appendectomy who is reporting difficulty falling asleep. Which intervention will be most appropriate? A. Close the door to decrease noise from unit activities. B. Adjust temperature in the patient's room to 21 degrees Celsius, 70 degrees Fahrenheit. C. Ensure that the night light in the patient's room is working. D. Encourage the discontinuation of a soda and chocolate nightly snack. Rationale: discontinuing the soda and chocolate nightly snack will be most beneficial for this patient since it has two factors that will cause difficulty falling asleep. Coffee, tea, colas, and chocolate act as stimulants, causing a person to stay awake or to awaken throughout the night. Personal preference influences the temperature of the room as well as the lighting of the room. Noise can be a factor in the unit and can awaken the patient, but caffeine can make it difficult to fall asleep. A patient has obstructive sleep apnea. Which assessment is the priority? A. Gastrointestinal function. B. Neurological function. C. Respiratory status. D. Circulatory status. Answer: circurespiratory status. Rationale: in obstructive sleep apnea, the upper airway becomes partially or completely blocked, diminishing nasal airflow or stopping it. The person still attempts to breathe because the chest and abdominal movement continue, which results in loud snoring and snorting sounds. According to the ABCs of prioritizing care, airway and respiratory status takes priority over gastrointestinal, circulatory, and neurologic functioning. The patient has just been diagnosed with narcolepsy. The nurse teaches the patient about management of the condition. Which information from the patient will cause the nurse to intervene? A. Takes antidepressant medications. B. Naps shorter than 20 minutes. C. Sits in hot, stuffy rooms. D. Chews gum. Answer: circa sits in hot, stuffy rooms. Rationale: the nurse will intervene about sitting in a hot, stuffy room as this will make the narcolepsy worse, so this needs to be corrected. Patients with narcolepsy need to avoid factors that increase drowsiness, e.g. alcohol, heavy meals, exhausting activities, long-distance driving, and long periods of sitting in hot, stuffy rooms. Patients are treated with antidepressants, and management techniques involve scheduling naps no longer than 20 minutes and chewing gum. Additional management techniques include exercise, light high-protein meals, deep breathing, and taking vitamins. The nurse is caring for a patient who has been in holding in the emergency department for 24 hours. The nurse is concerned about the patient's experiencing sleep deprivation. Which action will be best for the nurse to take? A. Expedite the process of obtaining a medical surgical room for the patient. B. Pull the curtains, shut, dim the lights, and decrease the number of visitors. C. Obtain an order for a hypnotic medication to help the patient sleep. D. Ask everyone in the unit to try to be quiet so the patient can sleep. Answer: A. Expedite the process of obtaining a medical surgical room for the patient. Rationale: the most effective treatment for sleep deprivation is elimination or correction of factors that disrupt the sleep pattern. Obtaining a private room in the medical surgical unit for the patient will help with decreasing stimuli and promoting more rest than an individual can obtain in an emergency department, even with the interventions mentioned. During rounds on the night shift, you note that a patient stops breathing for 1 to 2 minutes several times during the shift. This condition is known as A. Cataplexy. B. Insomnia. C. Narcolepsy. D. Sleep apnea. Answer: D. Sleep apnea. The nurse is completing a sleep assessment on a patient. Which tool will the nurse use to complete the assessment? A. Visual analog scale. B. Cataplexy scale. C. Polysomnogram. D. Ross scale. Answer: A. Visual analog scale. Rationale: the visual analog scale is utilized for assessing sleep quality. Cataplexy, or sudden muscle weakness during intense emotions such as anger, sadness, or laughter, occurs at any time during the day. There is no cataplexy scale for sleep assessment. A polysomnogram involves the use of EEG and EOG to monitor stages of sleep and wakefulness during nighttime sleep. This is used in a sleep laboratory study. Researchers believe that the ascending reticular activating system, ROS, located in the upper brainstem, contains special cells that maintain alertness and wakefulness. However, there is no assessment tool called the ROS scale. The nurse is beginning a sleep assessment on a patient. Which question will be most appropriate for the nurse to ask initially? A. What is going on? B. How are you sleeping? C. Are you taking any medications? D. What did you have for dinner last night? Answer B. How are you sleeping? Rationale. Sleep is a subjective experience. Only the patient is able to report whether or not it is sufficient and restful. Asking patients how they are sleeping is an introductory question. After this beginning question is asked problems with sleep such as the nature of the problem, signs and symptoms, onset and duration of the issue, severity, predisposing factors, and the effect on the patient can be assessed. What is going on is too broad and open-ended for information about sleep to be obtained specifically. Medications and food intake can be part of a detailed assessment of sleep issues. A 4-year-old pediatric patient resists going to sleep. To assist this patient, the best action to take would be A. Adding a daytime nap. B. Allowing the child to sleep longer in the morning. C. Maintaining the child's home sleep routine. D. Offering the child a bedtime snack. Answer C. Maintaining the child's home sleep routine. The nurse adds a nursing diagnosis of ineffective breathing pattern to a patient's care plan. Which sleep condition caused the nurse to assign this nursing diagnosis? A. Insomnia. B. Narcolepsy. C. Sleep deprivation. D. Obstructive sleep apnea. Answer D. Obstructive sleep apnea. Rationale. Obstructive sleep apnea (OSA) occurs when the muscles or structures of the oral cavity or throat relax during sleep. The upper airway becomes partially or completely blocked, diminishing airflow or stopping it for as long as 30 seconds. The person still attempts to breathe because chest and abdominal movements continue, resulting in snoring or snorting sounds. With narcolepsy, the person feels an overwhelming wave of sleepiness and falls asleep. Insomnia is characterized by chronic difficulty falling asleep. Sleep deprivation is a condition caused by dysomnia. OSA is the only one of these conditions that results in blockage of the airway and impacts the ability to breathe. Which of the following substances will promote normal sleep patterns? A. Alcohol. B. Narcotics. C. 1-tryptophan. D. Beta blockers. Answer C. 1-tryptophan. Rationale. 1-tryptophan is a natural protein found in milk, cheeses, and meats. The nurse is caring for a postpartum patient. The patient's labor has lasted over 28 hours within the hospital. The patient has not slept and is disoriented to date and time. Which nursing diagnosis will the nurse document in the patient's care plan? A. Insomnia. B. Impaired parenting. C. Ineffective coping. D. Sleep deprivation. Answer D. Sleep deprivation. Rationale. This patient has been deprived of sleep by staying awake during a 28-hour labor. Disorientation is one potential sign of sleep deprivation. In this scenario, there is a clear cause for the patient's lack of sleep, and it is a one-time episode. Insomnia, on the other hand, is a chronic disorder whereby patients have difficulty falling asleep, awaken frequently, or sleep only for a short time. This scenario does not indicate that this has been a chronic problem for this patient. Although ineffective coping can manifest as a sleep disturbance, clear evidence shows that it was labor that deprived this patient of sleep, not an inability to cope. It could be difficult to care for an infant when sleep deprived, however. This scenario gives no evidence that this mother displays impaired parenting and is not caring adequately for her child or lacks the skills to do so. The patient presents to the clinic with reports of irritability, being sleepy during the day, chronically not being able to fall asleep, and being tired. Which nursing diagnosis will the nurse document in the plan of care? A. Anxiety. B. Fatigue. C. Insomnia. D. Sleep deprivation. Answer: Circa insomnia. Rationale: insomnia is experienced when the patient has chronic difficulty falling asleep, frequent awakenings from sleep, and/or short sleep or non-restorative sleep. It is the most common sleep-related complaint and includes symptoms such as irritability, excessive daytime sleepiness, not being able to fall asleep, and fatigue. Anxiety is a vague, uneasy feeling of discomfort or dread accompanied by an autonomic response. Fatigue is an overwhelming, sustained sense of exhaustion with decreased capacity for physical and mental work at a usual level. Sleep deprivation is a condition caused by dysomnia and includes symptoms caused by illness, emotional distress, or medications. The nurse is preparing an older adult patient's evening medications. Which treatment will the nurse recognize as relatively safe for difficulty sleeping in older adults? A. Ramelteon, Rosarum. B. Benzodiazepine. C. Antihistamine. D. Kava. Answer: A. Ramelteon, Rosarum. Rationale: Ramelteon, Rosarum, a melatonin receptor agonist, is well tolerated and appears to be effective in improving sleep by improving the circadian rhythm and shortening time to sleep onset. It is safe for long and short-term use, particularly in older adults. The use of benzodiazepines in older adults is potentially dangerous because of the tendency of the drugs to remain active in the body for a longer time. As a result, they also cause respiratory depression, next-day sedation, amnesia, rebound insomnia, and impaired motor functioning and coordination, which leads to increased risk of falls. Caution older adults about using over-the-counter antihistamines because their long duration of action can cause confusion, constipation, and urinary retention. Kava promotes sleep in patients with anxiety. It should be used cautiously because of its potential toxic effects on the liver. The nurse is administering a benzodiazepine sleep aid to an older adult. What should be the priority assessment for the patient? A. Incontinence. B. Nausea and vomiting. C. Bradycardia. D. Respiratory depression. Answer: D. Respiratory depression. Rationale: benzodiazepines in older adults should be used on a short-term, limited basis. Respiratory depression is an adverse effect of benzodiazepines in older adults. Other adverse effects for which to assess include next-day sedation, amnesia, rebound insomnia, and impaired motor functioning and coordination. The 24-hour day-night cycle is known as A. Ultradian rhythm. B. Circadian rhythm. C. Infradian rhythm. D. Non-REM rhythm. Answer: B. Circadian rhythm. The nurse is developing a plan of care for a patient experiencing obstructive sleep apnea (OSA). Which intervention is appropriate to include on the plan? A. Instruct the patient to sleep in a supine position. B. Have patient limit fluid intake 2 hours before bedtime. C. Elevate the head of the bed to sleep. D. Encourage patient to take an over-the-counter sleep aid. Answer: Circa elevate the head of the bed to sleep. Rationale: lifestyle changes and modifications of sleep habits should be included on a plan of care for a patient with OSA. Individuals should sleep with the head of the bed elevated and use a side or prone position. Other modifications include a good sleep hygiene practices, alcohol modification, smoking cessation, and weight reduction. A patient suffers from sleep pattern disturbance. To promote adequate sleep, the most important nursing intervention is A. Administering a sleep aid. B. Synchronizing the medication, treatment, and vital signs schedule. C. Encouraging the patient to exercise immediately before sleep. D. Discussing with the patient the benefits of beginning a long-term nighttime medication regimen. Answer: B. Synchronizing the medication, treatment, and vital signs schedule. The nurse is caring for a patient on the medical surgical unit who is experiencing an exacerbation of asthma. Which intervention will be most appropriate to help this patient sleep? A. Place bed in semi-Fowler's position. B. Offer iron-rich foods for meals. C. Provide a snack before bedtime. D. Encourage the patient to read. Answer: A. Place bed in semi-Fowler's position. Rationale: placing the patient in a semi-Fowler's position eases the work of breathing. Respiratory disease often interferes with sleep. Patients with chronic lung disease such as emphysema or asthma are short of breath and frequently cannot sleep without 2 or 3 pillows to raise their heads. Iron-rich food may help a patient with restless legs syndrome. Providing a snack and encouraging the patient to read may be good interventions for patients. But the most appropriate would be raising the head of the bed. Which statement made by the parent of a school-aged child requires follow-up by the nurse? A. I encourage evening exercise about an hour before bedtime. B. I offer my daughter a glass of warm milk before bedtime. C. I make sure that the room is dark and quiet at bedtime. D. We use quiet activities such as reading a book before bedtime. Answer: A. I encourage evening exercise about an hour before bedtime. Rationale: best evidence related to sleep hygiene recommends avoiding exercise within 2 hours of bedtime. Exercise should be in the morning or afternoon. Encourage the parent to use quiet activities before bedtime to promote sleep. A young mother has been hospitalized for an irregular heartbeat dysrhythmia. The night nurse makes rounds and finds the patient awake. Which action by the nurse is most appropriate? A. Inform the patient that it is late and time to go to sleep. B. Ask the patient if she would like medication for sleep. C. Recommend a good movie that is on television tonight. D. Take time to sit and talk with the patient about her inability to sleep. Answer: D. Take time to sit and talk with the patient about her inability to sleep. Rationale: a nurse on the night shift needs to take time to sit and talk with patients unable to sleep. This helps to determine the factors keeping patients awake. Assessment is the first step of the nursing process. Therefore, assessment needs to be done first and involves ascertaining the cause of the patient's inability to sleep. Patients who are admitted to the hospital for uncertain diagnoses can be stressed and worried about the testing and outcomes. In addition, a young mother can be worried about the care of her children and those caring for the children. This uncertainty and change in routine can cause difficulty in resting or falling asleep. A distraction such as a television may or may not work for the patient. After assessment is completed, a sedative may or may not be in order. Telling the patient that it is late and time to go to sleep is not a therapeutic response for an adult who is under stress. The nurse is evaluating outcomes for the patient with insomnia. Which key principle will the nurse consider during this process? A. The patient is the best evaluator of sleep. B. The nurse is the best evaluator of sleep. C. Effective interventions are the best evaluators of sleep. D. Observations of the patient are the best evaluators of sleep. Answer A. The patient is the best evaluator of sleep. Rationale. With regard to problems with sleep, the patient is the source for evaluating outcomes. The patient is the only one who knows whether sleep problems have improved and what has been successful. Interventions are not the best indicator. Achievement of goals according to the patient is the best. Observations do provide needed data, but in the case of insomnia, the patient is the source for evaluating the restfulness of sleep. Which statement made by an older adult best demonstrates understanding of taking sleep medication? A. I take the sleep medicine for 4 or 5 weeks until my sleep problems disappear. B. Sleep medicines won't cause any sleep problems once I stop taking them. C. I'll talk to my health care provider before I use an over-the-counter sleep medication. D. I'll contact my health care provider if I feel extremely sleepy in the mornings. Answer. Circa. I'll talk to my healthcare provider before I use an over-the-counter sleep medication. Rationale. The use of non-prescription sleep medications is not advisable. Over the long term, these drugs lead to further sleep disruption even when they initially seemed effective. A patient has sleep deprivation. Which statement by the patient will indicate to the nurse that outcomes are being met? A. I wake up only once a night to go to the bathroom. B. I feel rested when I wake up in the morning. C. I go to sleep within 30 minutes of lying down. D. I only take a 20-minute nap during the day. Answer. B. I feel rested when I wake up in the morning. Rationale. Being able to sleep and feeling rested would indicate that outcomes are being met for sleep deprivation. Limiting a nap to 20 minutes is an intervention to promote sleep. Going to sleep within 30 minutes indicates a goal for insomnia. Waking up only once may indicate nocturia is improving but does not relate to sleep deprivation. An older adult patient is visiting the clinic after a fall during the night. The nurse obtains information on what medications the patient takes. Which medication most likely contributed to the patient's fall? A. Melatonin. B. L-tryptophan. C. Benzodiazepine. D. Iron supplement. Answer. Circa benzodiazepine. Rationale. The most likely cause is a benzodiazepine. If older patients who were recently continent, ambulatory, and alert become incontinent or confused and/or demonstrate impaired mobility, the use of benzodiazepines needs to be considered as a possible cause. This can contribute to a fall in an older adult. Short-term use of melatonin has been found to be safe, with mild side effects of nausea, headache, and dizziness being infrequent. Iron supplements may be given to patients with restless legs syndrome. Some substances such as L-tryptophan, a natural protein found in foods such as milk, cheese, and meats, promote sleep. While it does promote sleep, it is not the most likely to cause mobility problems. Which statement made by the patient indicates a need for further teaching on sleep hygiene? A. I'm going to do my exercises before I eat dinner. B. I'm going to go to bed every night at about the same time. C. I set my alarm to get up at the same time every morning. D. I move my computer to the bedroom so I could work before I go to sleep. Answer. D. I move my computer to the bedroom so I could work before I go to sleep. Rationale. This statement requires further teaching. Good sleep hygiene practices state that the bedroom should only be used for sleeping. Work and study should not be done in the bedroom. The nurse is caring for a patient who has not been able to sleep well while in the hospital, leading to a disrupted sleep-wake cycle. Which assessment findings will the nurse monitor for in this patient? Select all that apply. A. Changes in physiological functions such as temperature. B. Decreased appetite and weight loss. C. Anxiety, irritability, and restlessness. D. Shortness of breath and chest pain. E. Nausea, vomiting, and diarrhea. F. Impaired judgment. Answer: A. Changes in physiological functions such as temperature. B. Decreased appetite and weight loss. C. Anxiety, irritability, and restlessness. F. Impaired judgment. Rationale: the biological rhythm of sleep frequently becomes synchronized with other body functions. Changes in body temperature correlate with sleep pattern. When the sleep-wake cycle becomes disrupted, changes in physiological functions such as temperature can occur. Patients can experience decreased appetite, loss of weight, anxiety, restlessness, irritability, and impaired judgment. Gastrointestinal and respiratory, cardiovascular symptoms such as shortness of breath and chest pain are not symptoms of a disrupted sleep cycle. The nurse is caring for a patient in the intensive care unit who is having trouble sleeping. The nurse explains the purpose of sleep and its benefits. Which information will the nurse include in the teaching session? Select all that apply. A. NREM sleep contributes to body tissue restoration. B. During NREM sleep, biological functions increase. C. Restful sleep preserves cardiac function. D. Sleep contributes to cognitive restoration. E. REM sleep decreases cortical activity. Answer: A. NREM sleep contributes to body tissue restoration. C. Restful sleep preserves cardiac function. D. Sleep contributes to cognitive restoration. Rationale: sleep contributes to physiological and psychological restoration. NREM sleep contributes to body tissue restoration. It allows the body to rest and conserve energy. This benefits the cardiac system by allowing the heart to beat fewer times each minute. During stage 4, the body releases growth hormone for renewal and repair of specialized cells such as the brain. During NREM sleep, biological functions slow. REM sleep is necessary for brain tissue restoration and cognitive restoration and is associated with a change in cerebral blood flow and increased cortical activity. The patient and the nurse discuss the need for sleep. After the discussion, the patient is able to state factors that hinder sleep. Which statements indicate the patient has a good understanding of the teaching? Select all that apply. A. Drinking coffee at 7 p.m. could interrupt my sleep. B. Staying up late for a party can interrupt sleep patterns. C. Exercising 2 hours before bedtime can decrease relaxation. D. Changing the time of day that I eat dinner can disrupt sleep. E. Worrying about work can disrupt my sleep. F. Taking an antacid can decrease sleep. Answer: A. Drinking coffee at 7 p.m. could interrupt my sleep. B. Staying up late for a party can interrupt sleep patterns. D. Changing the time of day that I eat dinner can disrupt sleep. E. Worrying about work can disrupt my sleep. Rationale: caffeine, alcohol, and nicotine consumed late in the evening produce insomnia. Worry over personal problems or situations frequently disrupt sleep. Alterations in routines, including changing meal times and staying up late at night for social activities, can disrupt sleep. Exercising 2 hours before bedtime actually increases a sense of fatigue and promotes relaxation. Taking an antacid does not decrease sleep. A community health nurse is providing an educational session at the senior center on how to promote sleep. Which practices should the nurse recommend? Select all that apply. A. Take a nap in the afternoon. B. Sleep where you sleep best. C. Use sedatives as a last resort. D. Watch television right before sleep. E. Decrease fluids 2 to 4 hours before sleep. F. Get up if unable to fall asleep in 15 to 30 minutes. Answer B. Sleep where you sleep best. C. Use sedatives as a last resort. E. Decrease fluids 2 to 4 hours before sleep. F. Get up if unable to fall asleep in 15 to 30 minutes. Rationale. The nurse should instruct the patient to sleep where he or she sleeps best, to use sedatives as a last resort to decrease fluid intake, to cut down on bathroom trips, and, if unable to sleep in 15 to 30 minutes, to get up out of bed. Naps should be eliminated if they are not part of the individual's routine schedule, and if naps are taken, they should be limited to 20 minutes or less a day. Television can stimulate and disrupt sleep patterns. The nurse is caring for a group of patients who have sleeping disruptions. Match the condition to the intervention the nurse will use. A. Use continuous positive airway pressure. B. Offer a small meal several hours before bedtime. C. Administer antidepressants. D. Administer modafinil provigil. E. Do not startle. F. Administer benzodiazepine-like drugs. 1. Cataplexy. 2. Narcolepsy. 3. Insomnia. 4. Hiatal hernia. 5. Sleepwalking. 6. Obstructive sleep apnea. Which sleep hygiene actions at bedtime can the nurse delegate to the nursing assistant? Select all that apply. 1. Giving the patient a back rub. 2. Turning on quiet music. 3. Dimming the lights in the patient's room. 4. Giving the patient a cup of coffee. 5. Monitoring for the effect of the sleeping medication that was given. Answer. 1. Giving the patient a back rub. 2. Turning on quiet music. 3. Dimming the lights in the patient's room. All of the following are symptoms of sleep deprivation except A. Irritability. B. Hyperactivity. C. Decreased motivation. D. Rise in body temperature. Answer. D. Rise in body temperature. Rationale. Sleep deprivation symptoms include blurred vision, decreased reflexes, slow response time, cardiac arrhythmias, confusion, increased pain sensitivity, irritable, withdrawn, hyperactive, decreased motivation, sleepiness. Which nursing interventions best promote effective sleep in an older adult? Select all that apply. 1. Limit fluids 2 to 4 hours before sleep. 2. Ensure that the room is completely dark. 3. Ensure that the room temp is comfortably cool. 4. Provide warm covers. 5. Encourage walking an hour before going to bed. Answer. 1. Limit fluids 2 to 4 hours before sleep. 3. Ensure that the room temp is comfortably cool. 4. Provide warm covers. Which statement made by the patient indicates an understanding of sleep hygiene practices? 1. I usually drink a cup of warm milk in the evening to help me sleep. 2. If I exercise right before bedtime, I will be tired and fall asleep faster. 3. I know it does not matter what time I go to bed as long as I am tired. 4. If I use hypnotics for a long time, my insomnia will be cured. Answer. 1. I usually drink a cup of warm milk in the evening to help me sleep. The nurse incorporates which priority nursing intervention into a plan of care to promote sleep for a hospitalized patient? A. Have patient follow hospital routines. B. Avoid waking patient for non-essential tasks. C. Give prescribed sleeping medications at dinner. D. Turn TV on low to late night programming. Answer B. Avoid waking patient for non-essential tasks. Rationale. Avoiding awakening patient for non-essential tasks promotes sleep. Cluster activities and allow the patient time to sleep. Do not perform tasks such as lab draws and bathing during the night unless absolutely essential. Patients should try to follow home routines related to sleep habits. The school nurse is teaching health-promoting behaviors that improve sleep to a group of high school students. Which points should be included in the education? A. Go to bed at the same time each night. B. Study in your bedroom to have quiet space. C. Turn on the television to help you fall asleep. D. Avoid drinking coffee or soda before bedtime. E. Turn off your cell phone at bedtime. Answer A. Go to bed at the same time each night. D. Avoid drinking coffee or soda before bedtime. E. Turn off your cell phone at bedtime. A nurse is taking a sleep history from a PT. Which statement made by the PT need further follow-up? 1. I feel refreshed when I wake up in the morning. 2. I use soft music at night to help me relax. 3. It takes me about 45 to 60 minutes to fall asleep. 4. I take the pain medication for my leg pain about 30 minutes before I go to bed. Answer 3. It takes me about 45 to 60 minutes to fall asleep. Mrs. Peterson complains of difficulty falling asleep, awakening earlier than desired, and not feeling rested. She attributes these problems to leg pain that is secondary to her arthritis. What would be the appropriate nursing diagnosis for her? A. Fatigue related to leg pain. B. Insomnia related to arthritis. C. Deficient knowledge related to sleep hygiene measures. D. Insomnia related to chronic leg pain. Answer D. Insomnia related to chronic leg pain. Rationale. The related factor of the sleep disturbance for this patient is chronic leg pain. The nurse is caring for a patient who is having trouble sleeping. Which action will the nurse take? A. Suggest snug-fitting nightwear. B. Provide a favorite beverage. C. Encourage deep breathing. D. Walk with the patient. Answer. Circa encourage deep breathing. Rationale. Relaxation exercises such as slow, deep breathing for 1 or 2 minutes relieve tension and prepare the body for rest. Instruct patients to wear loose-fitting nightwear. Walking and drinking a favorite beverage would not necessarily encourage sleep. The nurse is caring for a patient in the sleep lab. Which assessment finding indicates to the nurse that the patient is in stage 4 in REM? A. The patient awakens easily. B. The patient's eyes rapidly move. C. The patient is difficult to awaken. D. The patient's vital signs are elevated. Answer C. The patient is difficult to awaken. Rationale. The patient is difficult to arouse. Vital signs are significantly lower, and this stage lasts about 15 to 30 minutes. Stage 4 in REM is the deepest stage of sleep. Lighter sleep is seen in stages 1 and 2, where the patient awakens easily. REM sleep is characterized by rapid eye movement. The patient reports episodes of sleepwalking to the nurse. Through understanding of the sleep cycle, the nurse recognizes that sleepwalking occurs during which sleep phase? A. Rapid eye movement, REM sleep. B. Stage 1 non-rapid eye movement NREM sleep. C. Stage 4 NREM sleep. D. Transition period from NREM to REM sleep. Answer: circa stage 4 NREM sleep. Rationale: stage 4 NREM sleep is the deepest stage of sleep. It is difficult to rouse the sleeper in this stage. During this stage, sleepwalking and enuresis bedwetting sometimes occur. Which nursing observation of the patient in intensive care indicates the patient is sleeping comfortably during an REM sleep? A. Eyes closed, lying quietly, respirations 12, heart rate 60. B. Eyes closed, tossing in bed, respirations 18, heart rate 80. C. Eyes closed, mumbling to self, respirations 16, heart rate 68. D. Eyes closed, lying supine in bed, respirations 22, heart rate 66. Answer: A. Eyes closed, lying quietly, respirations 12, heart rate 60. Rationale: during an REM sleep, biological function slow. During sleep, the heart rate decreases to 60 beats per minute or less. The patient experiences decreased respirations, blood pressure, and muscle tone. Heart rates above 60 are too high and respirations of 22 are too high to indicate comfortable REM sleep. The nurse is teaching a new mother about the sleep requirements of a neonate. Which comment by the patient indicates a correct understanding of the teaching? A. I can't wait to get the baby home to play with the brothers and sisters. B. I will ask my mom to come after the first week when the baby is more alert. C. I can get the baby on a sleeping schedule the first week while my mom is here. D. I won't be able to nap during the day because the baby will be awake. Answer: B. I will ask my mom to come after the first week when the baby is more alert. Rationale: the patient indicates an understanding when asking the mother to come after the first week. The neonate up to the age of 3 months averages about 16 hours of sleep a day, sleeping almost constantly during the first week. The baby will sleep rather than play. The baby will not be on a sleeping schedule the first week home. The mother will be able to nap since the baby sleeps 16 hours a day. A 72-year-old patient asks the nurse about using an over-the-counter antihistamine as a sleeping pill to help her get to sleep. What is the nurse's best response? 1. Antihistamines are better than prescription medications. BC prescriptions can cause a lot of problems too. Antihistamines should not be used. BC they can cause confusion and increase risk of falls. 3. Antihistamines are effective sleep aids. BC they do not have many side effects. 4. OTC medications when combined with sleep hygiene measures are a good plan for sleep. Answer 2. Antihistamines should not be used. BC they can cause confusion and increase risk of falls. The nurse is contacting the healthcare provider about a patient's sleep problem. What is the correct order for the steps for SBAR? 1. Mrs. Dodd, 46 years old, was admitted 3 days ago following a motor vehicle accident. She is in balanced skeletal traction for a fractured left femur. She is having difficulty falling asleep. 2. Dr. Smithson, this is Pam, the nurse caring for Mrs. Dodd. I'm calling because Mrs. Dodd is having difficulty sleeping. 3. I'm calling to ask if you would order a hypnotic such as Zolpidem, Ambien, to use on a PRN basis. 4. Mrs. Dodd is taking her pain medication every 4 hours as ordered and rates her pain as 2 out of 10. Last night she was still awake at 0100. She states that she is comfortable but just can't fall asleep. Her vital signs are BP 124/76, P78, R12 and T 37.1 degrees Celsius, 98.8 degrees Fahrenheit. Correct order for the steps for SBAR2. Dr. Smithson, this is Pam, the nurse caring for Mrs. Dodd. I'm calling because Mrs. Dodd is having difficulty sleeping. 1. Mrs. Dodd, 46 years old, was admitted 3 days ago following a motor vehicle accident. She is in balanced skeletal traction for a fractured left femur. She is having difficulty falling asleep. 4. Mrs. Dodd is taking her pain medication every 4 hours as ordered and rates her pain as 2 out of 10. Last night she was still awake at 01:00. She states that she is comfortable but just can't fall asleep. Her vital signs are BP 124/76, P78, R12 and T 37.1 degrees Celsius, 98.8 degrees Fahrenheit. 3. I'm calling to ask if you would order a hypnotic such as Zolpidem, Ambien, to use on a PRN basis. Which statement made by a mother being discharged to home with her newborn infant indicates that she understands the discharge teaching related to best sleep practices? 1. I'll give the baby a bottle to help her fall asleep. 2. We'll place the baby on her back to sleep. 3. We put the baby's stuffed animals in the crib to make her feel safe. 4. I know the baby will not need to be fed until the morning. Answer 2. We'll place the baby on her back to sleep. A nurse is taking a sleep history from a patient. Which statement made by the patient needs further follow-up? 1. I feel refreshed when I wake up in the morning. 2. I use soft music at night to help me relax. 3. It takes me about 45 to 60 minutes to fall asleep. 4. I take the pain medication for my leg pain about 30 minutes before I go to bed. Answer 3. It takes me about 45 to 60 minutes to fall asleep. A nursing care plan for a patient with sleep problems has been implemented. All of the following would be expected outcomes except A. Report satisfaction with amount of sleep. B. PT falls asleep within 1 hour of going to bed. C. Reports no episodes of awakening during the night. D. Rates sleep as an 8 or above on visual analog scale. Answer. B. Patient falls asleep within 1 hour of going to bed. Rationale. A sleep promotion plan frequently requires many weeks to accomplish. Which statements from a patient indicate an understanding of behaviors that will promote sleep? 1. I will not watch television in bed. 2. I will not drink caffeine later in the day. 3. A short nap later in the evening will lead to a more restful night of sleep. 4. I am going to start eating dinner closer to my bedtime. 5. I will start exercising regularly during the day. Answer. 1. I will not watch television in bed. 2. I will not drink caffeine later in the day. 5. I will start exercising regularly during the day. Which nursing interventions are appropriate to include in a plan of care to promote sleep for patients who are hospitalized? Select all that apply. Give PT a cup of tea 1 hour before bedtime. B. Plan vital signs to be taken before PDs are asleep. C. Turn TV on 15 minutes before bedtime. D. Have PDs follow at home bedtime schedule. E. Close the door to PD's room at bedtime. Answer. B. Plan vital signs to be taken before PDs are asleep. D. Have PDs follow at home bedtime schedule. E. Close the door to PD's room at bedtime. The nurse is providing health teaching for a patient using herbal compounds such as kava for sleep. Which points need to be included? Select all that apply. A. Can cause urinary retention. B. Should not be used indefinitely. C. May have toxic effects on the liver. D. May cause diarrhea and anxiety. E. Are not regulated by the FDA. Answer. B. Should not be used indefinitely. C. May have toxic effects on the liver. E. Are not regulated by the FDA. Rationale. Herbal products help promote sleep. These products need to be used cautiously because they are not regulated by the FDA. They should not be used longer term and can interact with prescribed medications. Kava needs to be used cautiously because it can be toxic to the liver. The nurse is discussing lack of sleep with a middle-aged adult. Which area should the nurse most likely assess to determine a possible cause of the lack of sleep? A. Anxiety. B. Loud teenagers. C. Caring for pets. D. Late night television. Answer. A. Anxiety. Rationale. During middle adulthood, the total time spent sleeping at night begins to decline. Anxiety, depression, and certain physical illnesses can affect sleep, and women can experience menopausal symptoms. Insomnia is common because of the changes and stresses associated with middle age. Teenagers caring for pets and late-night television can influence the amount of sleep. However, these are not the most common causes of insomnia in this age group. A single parent is discussing the sleep needs of a preschooler with a nurse. Which information will the nurse share with the parent? A. Most preschoolers sleep soundly all night long. B. It is important that the 5-year-old get a nap every day. C. On average, the preschooler needs to sleep 10 hours a night. D. Preschoolers may have trouble settling down after a busy day. Answer. D. Preschoolers may have trouble settling down after a busy day. Rationale. The preschooler usually has difficulty relaxing or settling down after long, active days. By the age of 5, naps are rare for children except those for whom a siesta is a custom. Preschoolers frequently awaken during the night. On average, a preschooler needs about 12 hours of sleep. The nurse is developing a plan for a patient who was diagnosed with narcolepsy. Which interventions should the nurse include on the plan? Select all that apply. A. Take brief 20-minute naps during the day. B. Drink a glass of wine with dinner. C. Eat a large meal at lunch rather than dinner. D. Establish a regular exercise program. E. Teach the patient about the side effects of modafinil, Provigil. Answer. A. Take brief 20-minute naps during the day. D. Establish a regular exercise program. E. Teach the patient about the side effects of modafinil, Provigil. Rationale. Take short naps during the day, and regular exercise are management strategies that help reduce the feeling of sleepiness. Modafinil is a stimulant used to treat narcolepsy. Therefore, it is important for patients to understand its side effects. The nurse is having a conversation with an adolescent regarding the need for sleep. The adolescent states that it is common to stay up with friends several nights a week. Which action should the nurse take next? A. Talk with the adolescent's parent about staying up with friends and the need for sleep. B. Discuss with the adolescent sleep needs and the effects of excessive daytime sleepiness. C. Refer the adolescent for counseling about alcohol abuse problems. D. Take no action for this normal occurrence. Answer. B. Discuss with the adolescent sleep needs and the effects of excessive daytime sleepiness. Rationale. Discussion regarding adolescent sleep needs should first occur with the adolescent. Although it may be common for this adolescent to want to visit with friends and experience activities that go late into the night, these activities can and do impact the hours of sleep and the physical needs of the adolescent, no matter the reason for the late nights, and they do need to be addressed. The nurse will address the adolescent, not the parents. Addressing alcohol abuse problems is not the next step but may be required later. While staying up late may be a normal occurrence for this adolescent, action is required. A nurse is teaching the staff about the sleep cycle. Which sequence will the nurse include in the teaching session? A. NREM stage 1, 2, 3, 4, REM B. NREM stage 1, 2, 3, 4, 3, 2, 1, REM C. NREM stage 1, 2, 3, 4, REM 4, 3, 2, REM D. In REM stage 1, 2, 3, 4, 3, 2, REM. Answer D. NREM stage 1, 2, 3, 4, 3, 2. REM rationale. The cyclical pattern usually progresses from stage 1 through stage 4 of NREM, followed by reversal from stages 4 to 3 to 2, ending with a period of REM sleep. The others are incorrect sequences.